Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM from Houston, Texas. This is COVID 19 World News. The topic today is vaccine digital passports. Before we begin with the feature presentation, I would like to invite you to take a look at my COVID 19 pandemic, an international guide on Amazon.com. While you're there, you can also check my other publications. So let us jump right into the feature presentation. COVID vaccine digital passports. Is this ready for prime time? What is COVID-19 digital passport? Why do we need it? Why not? Schools require proof of vaccination when you send your kids. When you travel to certain countries, they require you to have vaccination, for example, yellow fever. When you're in military, you have to have all kinds of vaccinations before you can leave the country. Otherwise, you have to get revaccinated. We need proof of vaccination for public safety. If you're a frontline worker, if you're working in a grocery store where you're coming across a lot of people, or a warehouse, or you are traveling, airlines are looking into implementing their own types of vaccine verifications. But this subject is much more complex than what it seems like, and I'm going to make it simplified in the next few minutes. Okay, the medical experts are arguing, where is the proof that vaccines prevent transmission of a coronavirus? Most of the studies that were done, which lasted for 2 to 3 months, looked at prevention of a coronavirus infection, but they never looked at the transmission of coronavirus infection. So there's no real data available. And how can you force people to have it, especially when these vaccines are on emergency use authorization? That's a fair argument. But if you look at from a public safety point of view, you see it with a different angle. We know the vaccine produces antibodies, it kills the virus, and by that we infer that the chances of this person carrying live virus is very small, and the chances of this person transmitting the infection is very small. I mean, this is based on the historical reports from treating people with vaccines for measles, mumps, smallpox, yellow fever, and many other communicable viral diseases. And we know when these people take vaccines, it prevents the spread of infection by almost 90% in case of measles. So there is indirect evidence that vaccination does prevent transmission of viral infections. Okay, how are we going to implement it? Are we going to use a paper record, a smartphone app, a digital electronic medical record? I mean, all these things have limitations, because if you're talking about a local hospital where you work or a workplace where you work, they can check your records, health records, and say, okay, you can check in. But if you're traveling on a flight within the country, or if you're traveling internationally, things get more complicated. You can't use paper records. They can be easily duplicated. Smartphone app, not everybody has an app, and what app is used in this country may be irrelevant in another country. In fact, China has an app which has a QR code which says if the person had positive COVID test. But only certain apps work in certain countries, so it cannot be universal. Digital medical records, how do you access digital medical records? How do you know what you're looking at? So what is the solution? First of all, we have to see how is it that certain things that we are doing right now that is internationally acceptable, that is in a digital form, that is less prone for counterfeit productions and is reliable. I mean, passport is something, and a driver's license or a passport is something that is fairly reliable. It's not 100%. We know people can duplicate passports, people can duplicate, you have seen all these James Bond movies, people can duplicate driver's license, things like that. But this is as close as we can get to have information that is reliable, that is internationally acceptable. So based on that concept, I have come up with a very, very simple plan. It doesn't need any app. It doesn't need anything extra. It's called the NIK's COVID Vaccine Digital Record. It can be a QR code or a barcode, which can be easily read at workplaces, at airports, and anywhere else. This would contain the person's name as it appears on the passport, a date of birth, country of origin, types of vaccine or vaccines received by this person, dates, and any type of encoding data used for international travels. When we incorporate all these things into a QR code or a barcode, it is as close to coming to a passport, which can be saved as an image on your smart device. And if you don't have a smart device, just print the image, put it in your wallet, and show it at the check-in counters at your workplace or at your airports. They can scan that and they will see the real information. They look at you, they look at your bio data on the passport or your employee record. In that way, it's easy to administer. It does not involve any app, so you don't have to deal with different countries using different apps, and we can accomplish this. But put the question at the beginning, are we ready for prime time? And that is something that has to be determined, and it is going to be determined by the employers and the economic forces. If airlines require you to have vaccination proof, then you have a choice. Either you can fly that airlines or use a different mode of transportation. What do you think? What is the best approach? Leave your comments below and see how we can try to make this work, and should we have it to begin with. Thank you so much for watching this presentation, and please do subscribe to our channel, and we'll see you next time.